Deep breath in, all the way out, all the way, all the way. Perfect, good. Nice and easy.
Oh.
Perfect. Good. Other side.
Oh.
Perfect. Go ahead on your back. Good. Turn your head to the left a little bit.
Oh.
Good. A little stretch. Awesome. Good, relax. Perfect, good. Good. What's up guys, Dr. Drew here, back at Forza Chiropractic. Thank you for watching this video. If you have not seen our videos and you want more information on tips and tricks for chiropractic physical therapy, whether it's neck pain, headaches, migraine, sciatica, whatever it is, make sure you hit that like and subscribe button below. Today I'm here with Aaliyah.
Hey guys. She's
one of our PT techs. You guys have definitely seen her on the page if you guys are following us. She's never been adjusted before, so we are actually going to adjust her for the first time ever. Came in with lower back pain. We did our new patient consultation, x-rays exam. We took these x-rays, which we're about to show you, and just kind of work you guys through the process of people that have never got adjusted or never treatment and what that feels like. And she's going to have a first-hand testimonial today. So without further ado, let's go ahead. We're going to review her x-rays real quick. So this is a picture of Aaliyah from the front, an ADP lumbar spine here. You guys are going to see a few lines here. As you can see, these are the tops of her hips. What you're going to notice here on the right side, because this is her facing forward, is that she's got a 5.2 millimeter shift. So 25 millimeters is 1 inch, so it's not terribly bad. However, again, it's definitely going to throw off the chain reaction, as you guys can see. So what the computer does is going to trace through those dots or bumps in the back. So those dots and bumps that you can feel from the back of your neck all the way down your butt, those are called spinous processes. And so essentially, if I draw a straight vertical line, they should all line up. So when we do this, what we want to see is that all these dots line up together. And obviously that's not the case. So what we have to do in Aaliyah's case here is we have to adjust the spine, we have to drive this hip up on the right side, and then we have to use a chiropractic biophysics tool, which is called a scoli roll, which is going to wedge in between this rib and this hip, which is going to drive that essentially straight. That's a technique that we utilize in this office. You guys have seen it on other videos as well. Just to show you a little bit of what normal looks like, this is what a normal spine should look like. So as you're going to see here, top of the hips, nice and even. You're going to notice these dots right here. Those are the ones I was talking about. If you draw a straight vertical line, they should all line up nice and straight. The reason being, on the outside, you have these little circles or halos. Those are the actual joints. That's where the body distributes the weight from the top down. So if these dots line up, that means that these joints line up, which means the weight will go from this bone, transfer equally to the next, into the next, into the next, and the next. If the hips are level, that weight's going to divide equally in the hips and knees to the ground, which is ideally what we want. So in Aaliyah's case here, obviously it's not, so we're going to get her treated, get her tuned up. That way she's at 100% specifically as well. So a little bit more information to come as far as her treatment, but without further ado, again, we're going to get her adjusted. First time ever, never been adjusted before. She's a little nervous. You might be too. I was as well. And then after we get her adjusted, go through some trigger point work with her, we'll have her kind of give you a little bit of a one-on-one patient experience. All right, guys, first thing we're going to do is we want to warm up this tissue that's connected to the spine. We call those your paraspinal muscles because those are essentially parallel to the spine. So we use our Hypervolt here, our percussion muscle gun. We're just going to go nice and easy up and down the spine, get the top of those glutes. So essentially what I'm trying to feel is for those bumps or that tissue that's in a knot, and I want to just kind of work into that tissue until those neuroreceptors in the joints that were there. You never want to go directly on the spine. You want to be on the outside. If you're starting to touch the actual bone, those dots that we were talking about, that's going to cause discomfort. So we want to just go nice and easy. How's that pressure, Leah? Perfect. Good. All right, first thing we're gonna do, just stretch. So I'm gonna connect my hand to this top of the right hip and then the left shoulder and just stretch nice and easily. Just open up that back. Same thing here. Perfect. All right, so Leah, we are gonna adjust these bones that are out of alignment. You're going to hear that pop and the cracking, just skim the joint. So we're going to start in this mid to lower back, work our way up to the top, and then we're going to adjust these hips together. So easiest thing is just take a deep breath in. Good. All the way out. Perfect. Good. Deep breath in. All the way out. All the way, all the way. Perfect. Good. And have you relax your shoulder here on the right. There we go, good.
Oh.
Perfect, good. How was that?
Good.
All right, so like we talked about in the x-ray, her right hip is off. So I want to adjust this right side. I'm going to have her lay on her left side. So go ahead and lay on your left side like you're in bed. Give yourself a hug. You can relax your head on the table. Keep this bottom leg straight. You're going to bend this ankle and knee just like this. I'm going to grab your arms here. And I'm going to move your hips a little bit closer to the edge of the table here.
Okay.
And then I'm going to connect to this right hip. Nice and easy.
Oh.
Perfect. Good. Other side. Same principle here, guys. We're going to adjust the lower back, not just the hip. So go ahead and relax your head. Good.
Oh.
Perfect. Go ahead on your back. Just stretch the neck out just a little bit here. Just kind of relax on this tissue. This muscle, which is connected from your mastoid to your sternum, is called your SCM, sternocleidomastoid. So it gets tight a lot if you're looking at your phone or you're working at the desk all day. So what I typically like to do is just a couple passes, just relaxing that tissue. And I'm palpating the top bone here, the first bone in your spine all the way down to check. Good. Turn your head to the left a little bit.
Oh.
Good. A little stretch. Awesome. Good. Go ahead, come on up for me. Swing legs to the left. We're also going to adjust these shoulders too. So I'm going to reach around, grab her right elbow. Good, relax that shoulder. Good, relax. Perfect, good. Other side. Same thing. Good. Whew. First adjustment.
It was great.
So just tell the viewers, obviously, how you're feeling, your emotions. Was there any discomfort with the adjustment? Did you feel, anything good, bad, whatever? Tell the viewers a little bit how your experience was.
It felt really good, relieving. It was a little scary to hear like my bones cracking, of course, but other than that, I felt pretty comfortable and good.
Yeah, great job. She did phenomenal. One thing we always tell our patients after they get adjusted is making sure they hydrate. So we typically say take your body weight, divide it by 2. That's how many ounces of water you want to drink. It's pretty common for you to be sore after you got adjusted if you've never got adjusted before. We kind of correlate that soreness to if you haven't worked out in a while and you've gone to the gym and your legs are a little bit sore. So completely normal. Normal things are going to happen like that. But she's on the right path to her spinal health, and we look forward to video number 2.